Thank you, Gauri. Thank you, Prof. Kun Leong. Okay, just a few housekeeping announcements before we start. Can all the people who are not speaking, that means currently other than me, please mute your mics. At least it won't disturb everybody else. And I think we'll keep questions for the last. But if there's anything urgent, you can always put up your hand and I'll try to answer the question as it goes, right? So today I'm going to be talking about how to pick a suitable research topic. And this is specifically for a master's thesis project in the general surgery department. Currently, I think we have got 3 master's programs: the Masters of General Surgery, which is the biggest program, followed by the Masters of Pediatric Surgery and Masters of Neurosurgery. And all 3 programs require a thesis to be submitted as a requirement for exams. And so it is a very important component of the postgraduate program. What I'll be talking about today is specifically on how to pick a suitable research topic. The subsequent speakers will expand on some of the more important areas, including how to get a proper literature review and how to present your data and things like that. Eventually, later, as Prof. Kun Leong says, we'll have a series on statistical analysis, sample size, as well as how to defend your thesis. But that would be in later dates. So let's start with why do we need to do a research for a clinical master's program? Why is it important, right? I mean, for most of us, medical research is part of a surgical education, and we do it out of scientific interest. We do it because we want to contribute to medical knowledge. We want to understand research and statistical methods. We want to critically appraise a research paper. This is very important because when you read papers, you need to know what they're saying. Does it make sense? And do we need to, can we actually trust the data being presented? The only way to do that is if you know how to critically appraise it, and you need to know the research methodologies to do that, okay? And of course, you want to evaluate and apply evidence-based medicine based on current research. But for most of us, the most important, at least for most of y'all, the most important reason to do medical research, at least currently, would be because it's a precondition to sit for the final exams. You do not complete your thesis, you do not sit your exams. It's as simple as that. And that is the primary driver for research among the postgraduate students. Irrespective of what it is, what I can tell you after being in this institution for so many years is research is a very important part of medicine, and it's not just something you do by the by and move on. So you really, it will be good if you actually put in some work and try to complete it according to our schedule we've set up, so that you can peacefully study for your exams when your time comes, right? So these are the milestone targets which the postgraduate committee has come up with after much trial and error. We've been doing this, we've been trying this out for the past 3-4 years. I think Prof. Kun Leong knows this quite well. And finally, we have come up with this schedule. So this is specifically for the year 1 general surgery master's candidates. And this is assuming that you have passed your exam in July 2020. I mean, currently, that you have passed your exam currently. In which case, by July, we expect you to have a research question, and we expect you to already have spoken to your supervisor about your topic and area of interest, as well as research question. Sorry, is there a question? Okay, never mind.
Can you mute yourself if you want to enter? Mute yourself.
Okay, so moving on. So by December of this year, you are expected to defend your proposal, which means you must have a project proposal with methodology and feasibility. By mid-year 2, your literature review and ethics approval, as well as sample size, must have been completed. And by mid-year 3, data analysis and collection must be done. Okay, we expect a final draft, your first draft of your thesis by the beginning of your year 4. So let's say you started your year 1 in December 20. By December 23, you must send in your first draft, which includes introduction, literature review, dummy tables, etc. And by mid year 4, in July year 4, you should have a second draft pre-correction thesis. And your final defense is usually held 3 months prior to the exam. So in your case, your exams will be tentatively in November 24. The thesis defense will be somewhere in August, September of 24. So you have to have your final thesis and defense ready by somewhere in about June, July, August of 2024. And this is the milestone targets for a general surgery master's candidate who has started in December 2020. Of course, it varies a little bit in ped surgery and neurosurgery, which will be handled by your own postgraduate coordinators. Let's move on to the next one and the core topic today, how to assign a good research topic. So how do we select the correct research topic? A good research topic usually begins in the mind of the supervisor and or the trainee. And it usually is related to interest, to experiential or personal questions, journals and conferences, or a part of a larger research project, like a PhD or a clinical trial project. And this is where you usually develop your research topic. For a lot of y'all, since you are, since you have been working in the surgical field for the past 2, 3, 4 years, there would already be areas which you might be interested in, specific areas. Similarly, you would have gone for various conferences where certain people have brought up issues which you think you can use as your basis for your research topic. And that's how you develop the research topic itself. Of course, there are very specific criteria on how you refine that research topic into a good research question. The first and foremost is it feasible? Is it doable within the period of the study? Is it cost efficient? Is it funds friendly? Is it sample size friendly? And do you have the technical expertise? Feasible basically means, can you do it? Okay. Next, it must be interesting. That topic, whatever you have chosen, it must be interesting enough. And it must be novel. That means it must be a question that has not been answered yet, or it has not been answered yet in your particular setting or population. It must be done to either confirm or refute previous findings. It must be an ethical question. It must not endanger the particular population you're studying it on. It must be safe. It must be of social and scientific value. And finally, it must be relevant. It must advance scientific knowledge. That means the research you do must add on to the knowledge you already have. There's no point doing a research which does not advance scientific knowledge. It must influence clinical practice and impact health policy or guide future research. Of course, the last 3 components of relevancy may not be particularly applicable for a master's thesis, but eventually, hopefully, you would be doing research which would influence clinical practice, impact health policy, and guide future research. I explained earlier, feasibility is whether the particular question is doable. An example will be a randomized controlled trial of conservative versus surgical management for acute appendicitis. This is just a topic I picked randomly. This is obviously doable because we do see enough acute appendicitis patients. So you would probably have a reasonable number of patients. You must remember your actual time for doing the research is only 2 years between the end of your first year to the mid of your 4th year. That's about the amount of time you have. Of course, if you minus the time you spend for your research proposal as well as your research writing up, it leaves you barely 18 to 24 months to do this. So does your research sample size, are you able to collect, actually collect the sample size within that period? That is the most important bit. Okay, so you must, the first topic, acute appendicitis, that's obviously doable. But if you look at the second topic, a randomized control trial of conservative versus surgical management for Meckel's diverticulum, do you all think it's doable? Meckel's diverticulum is already a very rare condition. You probably see 1 or 2 a year. And to do a study on that, especially a randomized control trial, it just doesn't make sense, right? Similarly, a prospective feasibility study of robotic appendicectomy. Do you have the technical expertise? These are the questions you have to answer for feasibility before you decide whether a topic is doable. What about interesting? Efficacy of local analgesia in laparotomy wound pain, or alternatively, a retrospective review of outcome of appendicectomy in UMMC, or an audit of varicose veins in UMMC. I mean, these are, I don't know, they are not interesting enough. For one, they have been done multiple times. A retrospective review of outcome of appendicectomy. Appendicectomy has been studied in various hundreds of papers. And what are you going to achieve by doing a retrospective review? Okay. Similarly, an audit of varicose veins. It doesn't really advance science much. It doesn't interest people. Nobody's going to stand up and say, oh, wow, that's a very interesting study, right? So you have to pique the people's interest, especially your lecturers. And you have to try to choose something that will be interesting. Novelty. It must be a question that has not been answered yet. Or it could be in a new setting or new population. So something like the effect of preoperative pregabalin in postoperative pain control and spine surgery. Okay, so you are trying to take pregabalin, which has been used as a pain control, but now specifically for pain control in post-spine surgery. So you're trying to move that topic into a new setting or a new population. Okay. Similarly, the role of interleukin and TNF in predicting gastric tumor recurrence. You know that interleukin and TNF has been used in cancer, but you're bringing it to a specific setting. And you want to either confirm or refute previous findings. And that's how you establish the novelty of a research topic. What about ethical? Ethical research is extremely important. We have previously rejected research topics because we thought they were not ethical. A simple example will be the role of prophylactic antibiotics in VP shunt surgery. Is that even ethical? I mean, we have established that antibiotics are necessary before you do prophylactic antibiotics are necessary before you do certain procedures like VP shunt. And yet, if
Mama suruh buat.
Sorry, whoever's unmuted, can you please mute yourselves? Right, thank you. So going back, right, where was I? So the role of a prophylactic antibiotic in VP shunt surgery. It is really unethical for us to try to assess the value of antibiotics in VP shunt surgery when it's been a long established tradition that antibiotics actually reduce infection. And it is not possible for you to do a study like this. Okay. However, if you want to do a trial of antibiotics versus no antibiotics, that's unethical. But if you want to do a trial of new antibiotics versus current antibiotics, that may be doable, right? Because you are just trying to find something which is more efficient than what you have currently, in which case it becomes ethical. What about cell savers in routine cardiac surgery? Would you be able to assess a cell saver? We know for a fact that cell savers are actually useful. So if you want to do a trial of cell savers versus no cell savers, you're actually disadvantaging a certain group of patients who you do not use what has been traditionally used in all patients. So you should never disadvantage the patient just to advance scientific knowledge. And these are the ethical issues you have to consider when you bring in your research topic. What about relevance? Identification of biliary microorganism during cholecystectomy. You have to remember most of the topics I'm giving you here are from your previous seniors, okay? And these were like this one is a particular topic presented a year or two ago. Even the antibiotics and all was previously presented. So These are topics your seniors have brought to us, okay? But when you bring something like identification of biliary microorganism during cholecystectomy, is that actually going to make a difference for us? At the end of the day, you're doing the cholecystectomy. Once you have done the cholecystectomy, identifying the organism does not change the recovery of the patient at all. So there is no actual relevance, there is no influence of clinical practice that may make a difference. On the other hand, let's talk about comparison between two methods to assess urodynamic flow study. On the surface of it, it looks like you're just comparing two different methods. But the relevance is, one is a much more cost-effective method, which you can advance in low and middle income countries. So it might be useful for to save cost. In that terms, it becomes much more relevant from a cost-effective perspective. So you must always make sure the study you take up must be relevant, right? What I explained just now, the feasibility, interesting, novelty, ethical relevance, is what we call the FINER criteria. And the FINER criteria is a necessary test for every research question. You must pass the FINER criteria before you can actually advance your research itself. Let's move on to the elements of a research topic. What are the basic elements of a research proposal? One, you have to have a appropriate introduction or a background. You must in which you explain why is your study important. So what if you do the study? You must explain your research question and the objective or the purpose. You must have a definite method, the design, what is the setting of the research, which population are you looking at, what is the sample size you need, how have you obtained ethics approval, do you need funds either internally or externally. These are the things you need to cover in your methods. And finally, you must have an appropriate timeline. The background or the introduction should cover what the problem is. It must have, it must answer 4 important questions. What is the problem you want to investigate? What is already known about the problem? What do you think is unknown or can be improved? And how do you want to achieve this? These 4 questions are the basic of an introduction in any proposal. If you answer these 4 questions, even in 4 lines, that's more than enough as an introduction, because these are the basic elements of an introduction for research. The research question itself is the crux of your research. It is a simple statement of the problem you want to investigate. And usually it is then translated into research objectives of one primary objective, which covers the main outcome, as well as 2 to 3 secondary objectives. Do not have more than 2 to 3, because you must remember every objective must be measured and must be presented as an outcome in your final thesis. So you cannot put an objective and then finally in your final thesis just cover only one of the objectives, because your assessors are going to ask you what happened to the other objectives. So be careful. Some of you will come and put up 5 or 6 or 7 objectives, and that just overwhelms you at the end, because you have to measure every one of them and you have to present every one of them, including their significance. So my suggestion is 1 primary objective and 2 or at most 3 secondary objectives. A good research question allows the target population to be clearly identified. It guides appropriate choice of study subjects. It identifies the outcome variables. It determines what type of study is needed. And it suggests the best way to collect the data, as well as influences the number of study participants. And when it comes to the method itself, again, you must present your study design, the inclusion-exclusion criteria, ethics, sampling techniques, description of measures, the instruments you use. The instruments are basically how did you measure the outcomes and what was the procedures used to collect the data, as well as the statistical methods to analyze the data. A lot of this information can be actually presented as in the form of a consort diagram. This is a typical consort diagram, which actually tells you how many patients were enrolled, how many patients were excluded, why were they excluded, what happened to the patient, if they were randomized, how were they allocated, what happened during follow-up, how many patients were fell out of the study, and what was the final analysis. So all of this can actually be put up in one simple consort diagram. And most of the time, this is one of the main things we look for when you're looking at the methodology of the study itself. One of the easy ways to assess the methodology is using the Picot criteria. Earlier, I told you about the final criteria to get the research question. But for the methodology, you use the Picot criteria, which is the patient, population or problem, I for the intervention, C for the comparison, O for outcome, and T for time. Okay, so let's take an example, a randomized controlled trial of conservative versus surgical management of acute appendicitis, which we discussed earlier. Okay, the P or the population here is the patients with acute appendicitis. The I or the intervention is conservative management, because most patients will undergo surgical management, but you are doing something different. You want to try conservative management here. Okay, the comparator, as I said, is a surgical management. So you've got patients with acute appendicitis. You want to intervene with conservative management, and you want to compare it with the standard surgical management. And the outcome is resolution of symptoms or reduction in morbidity. This is how you devise your methodology based on the Picot criteria. I spoke very briefly about Gantt charts or timeline. The Gantt chart is a very important tool to keep track of your progress of study. It tells it, I mean, most of the time you all just fill this up because it's required. But if you use it appropriately, it actually will guide you on when you need to do which part, and if there is a delay in the study, how to look for help. So the Gantt chart is an important part of your research itself. So we're coming to the last talk, which is the role of the research supervisor, and as well as how to troubleshoot. So the research supervisor, who has already been appointed for all of y'all, assists you in the selection of the appropriate research topic. They should be discussing the timeline, what I showed you earlier, and they should vet the proposal based on the final criteria. They should meet the trainee regularly, and they should read and correct the thesis presentations and written drafts as long as they've been provided prior to the deadlines. One of the problems we always have is you come to us last minute asking for either a research topic or discuss your thesis or your analysis, or even worse, you come to us last minute with your thesis, final thesis draft, and expect us to correct it overnight. We have made it very clear that you want to meet us, meet the supervisors, you have to make an appointment, and you have to give us appropriate time, an appropriate time frame. At least a week or two before you want to meet us, you must give us enough time to do the corrections. And specifically for the final thesis itself, you must give us at least 3 months prior to the final submission. Okay, I think Prof. Kun Leong might bring this up again later, but 3 months before submission, you must already present your thesis draft so that your research supervisor has enough time to do the corrections and give it back to you so that you can do your final corrections. What are the main trouble we have seen among students? Inadequate progress, unable to complete tasks on time, especially literature review, data collection, data analysis, unable to write your submission up on time, poor research standards, poor English and plagiarism. I think Tanya will touch a little bit on this. Unable to complete the thesis on time because of various reasons, including patient, not enough sample size, no equipment breakdown, etc. So these are the main trouble that you will face in the next 2 to 3 years. And you must at least have an idea of how to look for help or have backup plans in case things go wrong. And the primary thing to do is always reach out to your supervisors and discuss with them the moment you have any idea that there is trouble brewing. Where do you seek help? Of course, your primary endpoint is your research supervisor. That's a primary person you approach. However, you do have your clinical masters coordinator. For general surgery is Prof. Kun Leong. Pediatric surgery is Prof. Shireen, as well as neurosurgery is myself. Then we have got a department research unit with multiple research lecturers, including Dr. Tanya, Dr. Gauri, Dr. Jasmine, who are all will be willing to help you as long as you approach with your research supervisor. There is additional help from the research office in Faculty of Medicine. Library provides EndNote, Turnitin, SPSS softwares for free. There is always IPS, and I've attached the website for the guidelines for preparation of research project. So in summary, to devise a good research question, use the FINER criteria. To write up the research proposal, use the PICOT criteria, and you will be you will be able to come up with a reasonably decent thesis. Okay. Just before I finish off, this is very, very important. Avoid plagiarism. Plagiarism is basically presenting someone else's idea or words as though they were your own. This is both dangerous and unethical. And it is compulsory for you to use the plagiarism software Turnitin and to provide us with a Turnitin report with your final draft thesis. And if you exceed a certain number, I think Tanya will touch on this, it will be considered invalid. Okay. All right. Thank you.